So, folks, we've just had a couple of really amazing episodes on living well. And Jess and I decided we would try to have a brief conversation to distill and make some conclusions and share them with you. I think the first thing, Jess, I'd like to do is just again, what are the six things that Tom Frieden pointed out in his book and in our interview, the six things that help you stay healthy and help you have a long, healthy life. And again, what I love about it is that number one, it's based on epidemiologic evidence. So this is not conjecture. This is large bodies of evidence that's saying these are the six things. So let me run through them quickly. Just for folks, I would go back, listen to the episode with Tom Frieden, the one we just posted. But here they are. Number one, blood pressure control. Critical. Blood pressure is the single largest issue that is preventable. Number one cause for cardiovascular heart attacks, strokes, etc. Number one cause for all-cause mortality. It is the number one killer. So blood pressure is number one. Cholesterol, particularly LDL, is number two, controlling that. Number three is a healthy diet, largely around fruits and vegetables. Number four is physical activity, which, by the way, Tom calls the miracle drug. Okay. This is probably the public health officer, probably the greatest public health officer of our era, is saying that physical activity is the miracle drug of our time. The fifth one is getting enough sleep. That's 7 to 9 hours. And the sixth is avoiding toxins, tobacco, alcohol, the ones we can directly control. A little tougher are things like plastics, which, by the way, again, we can control to some extent as well. So those are the six: blood pressure, LDL, diet, physical activity, sleep, and toxins. What's really interesting to me, Jess, is I just reviewed the American College of Cardiology's 8 what they call life's essentials. So this is the American College of Cardiology. They've had this for a number of years. What was shocking to me was that they correlate exactly with what Dr. Frieden said. Theirs is eat better, be more active, quit tobacco and alcohol, get healthy sleep, manage your weight, control your cholesterol, manage your blood pressure, and manage your sugar. So they added basically weight and diabetes or sugar control to what Tom Frieden said. So you have two highly reputable sources. I mean, world-class, evidence-based, scientific sources that are saying it. And again, just the shocking thing is, and this is the whole point of what we've been exploring, and it's like you have all this other stuff happening. You have these wearables, these supplements. I mean, people are selling all kinds of stuff. And the question I think you and I have is that stuff really necessary?
Right.
Because what we really need to do is focus on what Dr. Frieden said to do, or what the American College of Cardiology. It's really not that complicated. And I'm not sure we need to be spending time and money and effort on what, quite honestly, I'm going to call snake oil. Okay. I think there's, unless you have something specific going on, or unless you're a high performance athlete, and some of you may be high performance athletes or consider yourself, those are exceptional cases. I'm not one of them. I'm not a high performance athlete. I just want to live healthy. I want my family to live healthy, my friends to live healthy, and have long, healthy lives, and avoid chronic disease, and push it off as far as we can. And the way to do that is not to have wearables or devices or supplements. The way to do that, there's no magic pill. The way to do that is through these 6 or 7 or 8 things. And they're, again, doing it is one thing, but at least knowing that it's not that complicated. Just you use wearables. I've used wearables. We both have used all kinds of apps. I have a fridge full of supplements. I mean, if there's a sucker, you're looking at them. So having said all that, what, in your opinion, what do the wearables, what information do they supply that correlates with what the experts, the real experts, are telling us in terms of what is actually going to help you live healthy and help you live healthy longer?
Yeah, I think it's a really important question. And I'd like to start with kind of two pieces. One is that these things are not complicated, but that doesn't make them easy. I think we really have to remember that it is not easy for everyone to eat more fruits and vegetables. It's not affordable for everyone to eat more fruits and vegetables. It's not easy for everyone to get their blood pressure to 120
Mm.
over 80, right? So, not complicated, yes. Easy, no. And I think that actually may be where wearables could come in. But the second piece of this is wearables are here. They're here to stay. They're a huge market. I think the last stat I saw was 35 to 50% of Americans own some sort of wearable, which is just like kind of shocking to me. And so I think rather than say, like, do we ditch all of the wearables, the question may be even more complex than that, which is if we're going to have these devices, if we're going to have these things, how could they be useful in helping us
Mhm.
achieve these 6 or 8 pieces that we now know, really direct personal health? And I guess the way that I see it now is, wearables track a lot of these things. They track them assuming you put the data in. They don't necessarily track them without you putting the data in. So you're really still doing the work. And then I don't know that they use their interpretive data skills as much as they could to help you figure out the correlations that would lead to behavior change. So, great example. My husband
Mhm.
has been monitoring his blood pressure lately just using a simple blood pressure cuff because his blood pressure, his systolic pressure has been in the 130s. And
Mhm.
he's debating with his PCP, does he need to go on, some sort of low dose medication? And he's been tracking that in a notes app on his phone, not in a tracker, not in a fancy app, right? And what he noticed is that the nights he went to jujitsu, the next morning his blood pressure, his systolic pressure was in the 120s.
Mm.
And so just by monitoring it and making his own correlation, he's able to sort of figure out this is stress, this is exercise, this is cardio, right? And so how do I then take that knowledge and make a behavior change, right? Do something differently so that I don't need to go on a medication. I can clearly get my blood pressure where it needs to be by doing exercise, shocker. But
Right.
he needed to make that correlation. And I think that's for me where the wearables are falling down. If I'm paying you $40 a month in a subscription fee, why isn't a wearable making that connection for me? So I'm not quite so sure that it's like ditch the wearables. We don't need them. They're here. They're very high-tech devices, but maybe we could direct them in a much more positive way to help with that behavior change piece.
Well, I'm gonna, and again, I don't disagree with you. Wearables are here. Having said that, I'm still not convinced that they're actually moving the dial. They're actually making. I mean,
Oh
the
yeah.
evidence isn't there. I haven't seen any evidence. No one's come to me with evidence showing me that wearables actually help people, help communities, help a population uh, stay healthier, help with again the important things. Do they actually change blood pressure, improve blood pressure? Do they change LDL, cholesterol? Do they help you with a better diet? Do they help you with better physical activity? Do they help you stay away from alcohol? I am not convinced that they do that. And again, measuring my readiness score or my heart rate variability, I'm going to call BS there. And again, I'm open. I'm not a world's expert. I've been talking to world's experts, but I'm open to being proven wrong about this. But right now, I think it's a lot of wasted. What I think it does, I think it helps the wearable device manufacturer because they're getting data, they're improving their machines, and they're charging us for it, which is just crazy to me. So I'm not against wearables. I don't understand it. And I for one, am not going to wear them and I'm not going to buy them. I'm not going to pay for them because I know what I should be doing. I'm going to do it. Now, to your point, having a tracker would be helpful. And that's where I think I'm in agreement with you here. We need a tool that helps us focus on the things, helps us customize it so we can see what we're doing. Are we doing the things we should be doing? Are we on track? And also, Jess, it's what you and I talked about. The hardest thing is behavior change.
Yeah.
What behavior change enablers are any of these things offering us? And so, um, the only way I can justify the money I've spent on supplements, which by the way, I can't justify, and I feel ashamed of myself, embarrassed by the fact that I've spent so much money on supplements. And again, there may be a couple of exceptions there, but for the most part, but maybe there's a placebo effect. I don't know. Maybe if I take a supplement, I think I'm healthier. Maybe I'll be healthier. I don't know. Um,
Well, but it makes me wonder, and you and I haven't talked about this, so I hope this is okay. But I kind of want to extend an invitation to anyone who has seen evidence of how wearables or anything else, like what is working for behavior change in these 6 or 8 areas? What is successfully making people exercise more? What is successfully helping with blood pressure control that is not a typical blood pressure medication? What is successfully helping with sleep? What is successfully helping with avoiding microplastics? Where are the biggest where are the biggest dangers there that we should be avoiding if we can and we can afford them? Where are cheap alternatives that actually work better? I think it'd be really interesting to have people on the show that talk about how are we successfully achieving behavior change
Right.
in those 6 areas? Because if you think about it, if that's really what's driving personal health, that's what I want to know. How are you avoiding
And
alcohol without ruining
right,
your social
right,
life? Like, how are you
right,
doing that?
right. And just, I just want to close this out by, and I would feel really remiss if I didn't say this. And I actually said this in the interview with Tom Frieden, which I hope people listen to. It's a short, 15, 20-minute interview. Really, really, I think could be life changing and game changing. It was for Tom Frieden when he discovered these 6 things. Um, I think, and this is really important for me, and it's important for me to share. And I've been talking to audiences about this. The playing field is not level. In no way, shape, or form do I think we should blame individuals because you're up against a, again, whether it's the food industry, the social media industry, multiple industries whose whole existence, who have postdoctoral PhDs, experts in marketing, who are trying to get you to consume things that aren't in your best interest, that aren't healthy for you. And so they've literally architected an environment around you that is unhealthy. And so it's not just like we're on a playing field and it's just like, the doctor says to you, you got to do these things. What the doctor doesn't understand is you're fighting armies and armies of professionals, highly experienced, who get lots of money to make sure that you consume their products. And I think that's the part that we overlook is how do you cocoon yourself? How do you protect yourself and your family from all these industrial complexes? And so I feel a tremendous amount of empathy for myself, for you, for everyone out there in trying to do the right thing because you are fighting the stream, you are swimming upstream, and anything you do along taking care of yourself, etc., diet, nutrition, activity, staying away, as you just pointed out, from alcohol, anything you can do, kudos to you. I think the answer, though, the answer is in the environment, is architecting the environment. When you look at the countries, when you look at the regions where people are healthy, it's not because of individual motivation or individual willpower. It's because they've reconstructed the environment to actually induce health, to make it easier to be healthy. So you're not swimming upstream against everything to do that. I think that's where the key is, not in these expensive wearable devices that, that's not the problem. They're not addressing the core issue. And by the way, the evidence is clear because we haven't moved the needle on it, especially in this country. $5.2 trillion we spent in 2024 on healthcare. It's going up. And what we're seeing is health staying the same, if not getting worse. I mean, blood pressure control, sugar control, et cetera, et cetera.
Well, so I think Zev, you just gave us our edict for where do we go next with this series, which is how are people doing that? How are people orchestrating an environment that's actually supportive? So I'd love to hear from guests that are able to help us with that, help us, figure that out because we do live in the United States and we have to operate within the world we have, but we can create these pockets of environments of support around us. So maybe we extend that as an open invite. We'd love to kind of continue that conversation and help people figure that out.
I think that would be a great direction. Thanks, Jess.